Day 2005 will be a date that I will never forget because of two words. 1 week prior, I woke up from my sleep in the most intense pain that I'd ever felt. Knowing that my mom was a nurse, she was the first one that I called, and I was admitted into Pitt County Memorial Hospital, not knowing that a week later, or it would take a week for me to be diagnosed. I had test after test done, and after a whole week, nobody could still tell me what was going on with me. And finally, after 6 days, I had a doctor walk in and say that he thought he knew what was wrong with me. So I had a test done, and a week later, he spoke the two words that changed my life: Crohn's disease. Today, I will be speaking with you about what this little-known disease is. Many people, just like me, experience this disease for months without knowing what it is, and it is important to create more awareness of it. Crohn's disease is an autoimmune disorder that affects the entire digestive tract. According to 100 questions and answers about Crohn's disease and ulcerative colitis, an autoimmune disease occurs when the body's immune system becomes confused and starts attacking normal organs and cells, believing they are foreign. Doctors and researchers still do not know what causes this response. Many times, due to the mystery of this disease, many are misdiagnosed. Because there is a lack of knowledge of why this happens, there is no evidence of what actually causes an individual to develop Crohn's disease. What is clear from research are the symptoms and signs of Crohn's disease. The first symptom of most patients is the onset of intense abdominal pain. This pain is due to ulcers that have developed in the digestive tract, or it is due to an obstruction that has occurred. Often, because of the abdominal pain, many experience the second most frequent symptom of weight loss. Weight loss occurs because once someone has eaten, the digestive system is active, which in return causes more pain. Another common reason for weight loss is lack of nutritional absorption that occurs in the body once the disease is active. Once an individual has confirmed diagnosis, treatment begins. With a mild case of Crohn's disease, a mesalamine can be prescribed. There are 4 types that can be prescribed, all depending on where the site of the disease is located. There are very little side effects that can take place while on it, which is why this drug can be taken for long periods of time. For those with a moderate case, corticosteroids can be used. Both prednisone and inocort are commonly used. They replace the body's natural functions of producing corticosteroids. These medications have more severe side effects, such as eyesight and osteoporosis, and are taken for short periods. Lastly, if patients have a severe bout of Crohn's, such as I, treatment becomes more intense with the use of immune modulators. Immune modulators work by stopping the body's entire immune system, therefore stopping the attack on the body. Although this is an efficient way of stopping the disease from worsening, the long-term side effects can be extreme as cancer. In conclusion, there needs to be more awareness of this disease so that more research can be done to provide better medication and treatment to patients. Just a few weeks ago, as I watched television, I became pleasantly surprised as I saw David Gerard, a former quarterback of ECU, speaking out about his struggle with Crohn's disease on a commercial. As awareness like this commercial grows, so does my hope for better treatment and maybe one day a cure.